we're going to do a polling question. We wanted to ask you a couple of questions here as we head into our speakers about to help us have a sense of where people are. So we want to know what you think. Is there a need for accreditation of health promotion as a profession in Canada right now? So tell us what you think. Oh, there seems to be some pretty, oh, we've got a no. I like to hear from the dissenters too, right? It makes for an interesting discussion. Very interesting. Very, very interesting. So, you know, if you've got some comments about the reason behind your response, whether it's yes or whether it's no, I'd love to hear some of that in the chat box. That'll help us give us some context as a group as we move forward with this work and considering the implications of this work. I think we can close the poll. It looks like it's done. Please let us know what you think in the chat box there, and that'll help lead the discussion. So we've got one more question for you as well before we head into our speakers. Have we got it, Danielle? Yeah, I think it's getting pulled over here. So again, do you think accreditation would enhance the integrity of health promotion positions? The interesting thing that I've always understood about health promotion positions and the practice of health promotion is that you know, it's sometimes lumped in, the practice of health promotion is sometimes lumped in with other functions in a number of organizations. And I worked frontline public health for 16 years before coming to Nova Scotia and the NCCDH. But and the answers are interesting here. You know, sometimes the practice of health promotion is lumped into other positions. Sometimes because of that, it wasn't seen as a distinct practice. Sometimes programs or departments were called health promotion departments or health promotion programs, which kind of weakened the presence of specific knowledge bases because it kind of lumped a whole bunch of things together. But then, in my later years, there was the creation and the emergence of positions as health promoters within public health organizations. So I think it's evolved. So, you know, in terms of whether it would enhance the integrity or not, I think that's also evolved and mixed. So, although I guess it's shifted here, so we seem to have an overwhelming yes on this one as well. So.